Hello and welcome to a new episode of our podcast, EuroHealth. Our guest today is Mr. Dvořáček, who is Deputy Minister at the Ministry of Health of the Czech Republic. Welcome.
Good afternoon, welcome.
You are responsible for, among other things, for the presidency agenda. So I guess your last 6 months were rather intensive and full of work.
It was. On the other hand, I have to say, we get somehow used to it, yeah. And I have to say, it was one of the most interesting half a year I ever had. So we will probably miss it already.
So, what were your priorities at the beginning of this 6 months, and what do you believe that you managed to achieve, and what you somehow miss?
So first of all, let me summarize that at the beginning we tried to really be in line, what our French colleague did. We have a trial presidency, and it's not always common, but we try to be and to build on what our French colleagues did. So we try to build on their steps towards the better oncology plan. So one of the key issues, for the Czech presidency was the oncology, not just the oncology cancer beating plan, but we also try to focus on the screening and to prepare the cancer recommendation to the oncology screenings, which I believe, we achieve it. And also, what our French colleagues did, and we try to move it forward, is the area of rare disease. We had two key events for the rare disease. One conference, which really covered the all areas from specialized centers who provides the care to the to the rare disease patient, but also the access to the treatment, the equality and equal access to all the patients around Europe, but also to gene-based screening. So there were two events, one in Prague, one in Brno, and the result were the call to action. And I was quite surprised. We achieved a big support from member states. So the rare disease were also one of the key priorities for the Czech Republic, and the rest also were based, on what happened in Europe. I mean, we are still in the COVID crisis, but let's say less and less. But from the early beginning, we saw there are a lot of difficulties with the existing supplies of vaccine to the member states. So we agreed with our colleagues from different states, and we agreed that we will try to move this topic on the political level. From the technical discussion, which were done by the steering board of DG HERA, we moved this topic, and we achieved, the big meeting of ministers, and we had the steering board on the ministerial level as a part of our informal EPSCO meeting in Prague. So the access to vaccines and the existing contracts with the Pfizer and with Moderna, it was also, the key issues for us. And then, we had to also reflect, the war crisis. So the refugees coming to Europe, the healthcare provided to those people, who seeks the shelter in the Europe, the availability of care to those people, and then generally, we had also the topics which were based on the legal development. So we were the chance to open and negotiate the first part of the European Health Data Space, the new regulation, which I believe is key for the competitiveness of the Europe, but also for the patients to get the access to their data, and also for the medical professionals to somehow see what are already done with the patient, and how they can build their care on the other work of the healthcare professionals around Europe, and then also this scientific part of the European Health Data Space. And I believe we did a tremendous job in this field. We had 17 working parties on the European Health Data Space, which is again quite a big number, and we moved the document quite far. And then the last one is the BTC, the blood tissue and plasma regulation, which is also very important, for the access of patients to the care. Those who are dependent on the products coming from blood and plasma. And that was, let's say, the key topics.
Okay, Gosh, you're the first guest ever who pretty much exhausted all my questions with his first answer. So
I tried to cover what you asked for.
Congratulations. But okay, let's get to bit more details. Let's start with the COVID, with the vaccination issues. I know they are not the first and foremost of your priorities, yet it's something that is being dealt with all the time. Do you think that this topic will keep its importance in the future, in next year? Do you think that it will be a matter of discussion still in 12 or 24 months from now?
I think so. And it's not based, on let's say, development of the COVID-19 pandemic, but what we will have to find is the solution, for the extensive supplies which we are receiving from pharmaceutical companies, from Pfizer and from Moderna. We already know that the existing amount which is supposed to be supplied to the member states will be exceeding the consumption and the need of the member states many times. So the Czech Presidency is just finishing the first part of negotiation or a negotiation of existing contracts with the suppliers, and I believe the Swedish Presidency and probably the upcoming trio, Spain, Hungary, and I believe Belgium. They will have to definitely continue, with what we started. So now we are just stepping, to the extension of the contract with Pfizer to the end of 25. But if we count, how many doses the member states order it in 2020 and 21, it will still be too many. And we can see, the big political pressure from all member states to somehow reduce the amount, to make it more rational, so we will not have to destroy amazing number of doses. And it's not just a political priority; it's also the let's say priority based of the nature sense. I mean, we just cannot pay and store something what we do not need it. So there will be a really heavy discussion which will come in coming months and years, which will be led by the Commission, by DG HERA, but I believe our Swedish colleagues and upcoming presidencies will have to really continue to have this discussion also on the political level.
Do you think that the Swedish presidency will be somehow influenced by their, let's say, significantly different approach to COVID and to the approach how to deal with the pandemics?
Probably not in the area we already mentioned it, because it's not on the Czech presidency or Swedish presidency. It's happened already in May. There was the letter of 10 member states, which were led by Poland, but it was signed by nearly all CE member states. And if you get the chance to see, the discussion at the last EPSCO meeting, which were public, all 27 ministers raised this topic and concerns, how to manage the future supplies. That there is probably no member state, who still have the storage capacity and who is not forced to destroy the big number of doses just because, they cannot utilize them.
Okay, so let's move a bit to another huge topic that is influencing not only the presidency, not only EU, but Czech Republic and Czech Ministry of Health as well, and that is war. You already mentioned that it's a huge priority to assure access to healthcare for the refugees. And what are supposed to be next steps? So what will be in the future? I know that a lot of refugees are already working, so they are already pretty well integrated. I know that there are a lot of even healthcare workers who are willing to work in the system, but they are still facing some. And I'm not saying that they are irrational, but definitely they are facing some administrative burdens. So, what are the plans of the ministry for that topic?
So let's start, with the care. Then we can move to HCPs, to healthcare professionals. What we did from the early beginning, we opened the system. We tried to really balance, the cost which is connected, let's say opening the system to them, and the cost which will be related, if there will be the people who will not have a chance to get care, and then anyway, we will have to treat them in more difficult conditions. So the decision was based on that. We agreed, the government agreed, to make, the refugees the state insurers. So it's opened the system for them. So, and I believe, it was a really good decision, the right decision. On the other hand, it also creates, the burden to the system, especially in the area of pediatric care. I mean, we received the same amount of kids, which came as refugees, the same amount is born in the Czech Republic in 1 year. It's more than 120,000 kids, who are here in the Czech Republic. And of course, already before the Ukrainian crisis, we had the problems to really have sufficient care.
Yeah,
absolutely. So, that was definitely the task for us. We try to extend the care. We create, the additional places to provide the primary care. Then we also get the support from the UNICEF and from WHO. And what we are doing now is that we are opening the financial support, for the ambulant care for pediatricians to get support and financial support to have let's say open the longer time their ambulances, to also have a chance to employ, for example, people, the medical professionals, pediatricians, who are retired or on the maternity leave. And I have to say that we have now around 35 ambulances, pediatric ambulances, who are part of the project and who will get financial support, to provide more care than they already did, and so on. On the other hand, it's also good to say that we were quite afraid, that there will be a big impact also on the hospital care and, for example, the oncology care, etc., etc. It didn't happen. I have to say that if I compare the cost, the consumption of the care of the Czech citizen, which is around 35,000 Czech crown per year, and what was already consumed, from the Ukrainian refugees, the average is around 3,500, so 10 times less. So it didn't materialize. They didn't misuse the care. That's what I have to highlight it. They really tried to use it, only in the difficult conditions. On the other side, there are a few areas which are, let's say, still very difficult for us. For example, tuberculosis. We have a really huge amount of people who are now, let's say, treated. Also the HIV, it's, let's say, we get 2 times more the new patient who are in the need of care than it's the year average. So it was really a big jump. Again, I think we managed, and the care is provided. We also built the support, for the Bulovka Hospital with financial help from WHO to get the more resources, more capacities. So again, this is something what we will deal with. So if I take the current situation, it's not perfect, but it's manageable. Of course, what we are now thinking of is how to prepare for possible escalation. Of course, if you see the temperature, if you see the current conditions, at the Ukraine, it will be maybe quite tough. So this is, let's say, the main focus from my team, from the Ministry of Health, but also I believe from these international NGOs. And the second half of question, you mentioned it, is the potential support for the Czech healthcare system, the healthcare professionals from Ukraine. Again, with UNICEF and with, it was mainly the UNICEF, I believe, we create 2 programs, one in Prague, which is, let's say, from the IPVZ, from our Institute for Postgraduate Training of the Medical Professionals. There are special courses of the Czech language, which focus on the healthcare, and also the training, how to prepare them to for the approbation and for the exams. We cannot and we do not want to make the current conditions less difficult. We try to have them less complicated. Yeah. So the quality needs to be assured. The medical professionals from Ukraine, they can already work with the supervision from the Czech healthcare professionals jointly as an internship at the hospitals. During the time they nostify their diploma and they prepare for the exams. And the same we did in Brno, for the let's say mid professionals, mid staff, for the hospitals, nurses and the other professions. And we also opened the two centers which focus on the career support. So for the advices and so on, how to get the job. On the other hand, it's also important to mention it that there is a strong request coming from the Ministry of Health of Ukraine that, of course, I mean, those healthcare professionals from Ukraine could help, but that the Ukraine and the minister himself raised it many times. They really want those people to return in the future back to Ukraine. So it's difficult to find the balance. Yeah, absolutely.
Mm-hmm. And there is a third part of the Ukrainian question. What about direct help to Ukraine? Is Ministry of Health in any way? We know that the government is supporting Ukraine with various arms and guns and ammunition and other stuff. So
luckily, we are not in this position to provide any ammunition.
but I guess there are still many things that that could be provided. So
yeah, no, I mean, it was a decision of the government at the beginning. They provide the medical supplies which we had as the extraordinary supplies, for crisis situation. So there was thousands of beds, provided, and the sets for the care provided to Ukraine. And what we did, and it's also cost us, some energy and time, because it's so complicated to provide the pharmaceuticals. You have to follow up with the good distribution practice and so on. And because the Ministry of Health is also the distributor, we have a distribution license. We agreed with Ministry of Foreign Affairs and with Ministry of Interior Affairs, because these two bodies are only allowed from the Czech administration to provide humanitarian support and help. That the Ministry of Health will be the part of that effort, and we will try to provide the pharmaceuticals which were donated by the pharmaceutical companies. It's important to say that those pharmaceuticals were always agreed after the discussion with State Department of Drug Control, to ensure that we are not sending the pharmaceuticals which are considered for the Czech patients. So it was additional supplies for pharmaceutical companies, donations, and it was more than 10 lorries, 10 trucks, which were provided full of the pharmaceuticals, different areas, from anti-infection pharmaceuticals, painkillers, etc., necessary, for the Ukrainian hospitals to provide the basic care for the patient. So yeah, that was what we did as the Ministry of Health, and it was done jointly with the industry and also with the wholesalers who help us to with logistic to Poland, where were created a special hub by the European Commission, where they concentrate all the humanitarian help, and then it was redistributed around the Ukraine jointly with the Ministry of Health of Ukraine.
Let's move a bit back to the issue of presidency and to the issue of maybe something that is a bit closer to your heart, and that is pharmaceutical legislation. Yeah, we know that you have huge experience in this area. So, what is your point of view on the pharmaceutical strategy for Europe and the future of this area?
Good question. Good question. Not easy to answer it. You aware, that the pharmaceutical package is supposed to be already drafted and discussed, during the French presidency. then at the beginning of Czech Presidency, then at the end of the Czech Presidency, and currently the latest information I have is that it's supposed to be opened by the Commission probably in March, April, the first quarter of 23. So the Czech Presidency will not touch it, this document. It will be on our Swedish colleagues. What is my worry is, if we will still have enough time. I mean, also the information which comes from the Commission is, that they want to have the antimicrobial resistance topic, the general pharmaceutic legislation, but also the orphan regulation, the pediatric regulation as a one package. So everything together. But then, if you use the basic mathematics, and time, we still have, till the end of this semester, this Parliament, European Parliament. I'm not sure if we still have enough time, because it will be a very complex document with number of very sensitive topics, where I believe, it will take some time to find a compromise between the member states. So the question mark is if it is still achievable. I hope so. And then, if not, if the new parliament can continue with the existing existing level of the let's say agreed parts of that material, and it's quite complex. And I can see that just the preliminary discussion we had it with our colleagues from member states. There is a lot of different views, how to solve the very differentiated access of patient to different kind of treatment. Also, the way, how the launches of new pharmaceuticals are happening recently. Again, it's obvious, you can see it, that you have the member states, where after the registration from EMA, you have in 1 month, you have the marketing authorization holder comes to the discussion and, agrees on the reimbursement, etc. And then you have member states, who waits, for another 5, 6, 7, 8 years. So you have some states where the marketing authorization holder never comes, to negotiate and to launch the new product. So there is a lot of different views on that, and it will be probably discussed, by the member states for quite some time. So I have some doubts, but it's necessary if you will not have it. Not just for the patient and for the treatment itself, but also for the competitiveness of the Europe, because this pharmaceutical package is supposed to also contain the support for R&D, the IP protection. For example, for rare disease, you have an extension for IP protection. Then, if it is rare and pediatric, another extension. So there is a lot of things, which needs to be agreed, and
we cannot be dependent on the United States forever, right? When it comes to R&D.
Yes, it's something. But again, the question mark is, how good we are in the basic research, the fundamental research, which I believe is quite good and fully competitive. Where we really lack, and when then the benefits come, it's those startups, university spin-offs, the patents are acquired, purchased, by the big international, but usually US-based, companies. Yeah. And we can see, that there is more and more discussion, how to ensure that if we use a public money to support the R&D, that the results stay in the countries where the R&D originated from, and or the Europe itself. I mean, if you take, how big funds, comes just, in the Czech Republic from Gatcher, for the basic research, from the Thatcher, for the applied research, how big funds comes, from European Commission to support the R&D, and how many of those exciting outcomes, are then produced, and where the royalties come them at the end. That's something, where we still need to find, let's say, the new way of approach.
The pharmaceutical area is something that you are dealing these days very much in the Czech Republic. We are dealing with this problem with the Nurofen for kids, and everybody is asking about that. But I think it's part of the wider problem. We are in the last 14 years we try to achieve as cheap pharmaceuticals as possible, which we, thanks to the referencing system, we pretty much achieved. But on the other side, a lot of insiders explain to me that, you can have very cheap pharmaceuticals, yet you cannot be surprised when the distributor or the producer decides to prioritize countries with the higher prices.
This area is, of course, quite sensitive, and what we do here in the Czech Republic is something, what is done by the majority of the member states. The referencing system do not reference the real prices. That's obvious. Yeah, the price in the Czech Republic is the average of three lowest, but the three lowest the prices which you can't really reference it. Then, if you come to the reality. The price, which is really then reimbursed and so on, is usually much lower all around Europe. It's for me the key let's say sign that the situation with pricing here is bad will be the high re-export. We have a free movement of goods. But if we talk about the generic products, which could be the area you mentioned, definitely not the area of patent-protected, the innovative product. Yeah, this is a totally different story, and definitely it's not about the low price here in the Czech Republic and the reimbursement. We have all those therapies like CAR-Ts, gene therapies. This is available for the Czech patient, and I assure you that the pharmaceutical company will never come here if the price will be not acceptable for them. Where I can see, the problem could be is some of the really old generics, where the situation where you have the package, for €1, €1.50, really, low cost pharmaceuticals. But usually it's not those, who are let's say re-exported from the Czech Republic. And if you see, for example, Germany, the very big, very strong market, where they run those huge tenders, where the states, German, the part of the German Republic, they comes together, the big Krankenkassen, those insurers, they run the tender for the whole Bavaria, etc., etc. You can't compare the price they get, from the tender with the Czech price. We are not doing those big national tenders. So usually we have really multiple suppliers in this field. And, for us, this is something, what could be solved. And we are very open, to do it, the case by case. They can use, something what is called the public interest. And they can call the payers, to provide a higher reimbursement in this case. But generally, I disagree that the pharmaceuticals are cheaper in the Czech Republic, especially the generics are cheaper than, for example, than in Germany. We can't really get the same price in the Germany if we do not have these national tenders. So the interruption of supplies are something, what the whole Europe is dealing with. And if you talk about the Nurofen, it's not Rx, you can buy it, without any recipe in the pharmacy. But if I go to the Rx products like the penicillins, it was not the issue of the Czech Republic. It was a whole Europe. It's based on the current situation, with the API origin, with the active substances. And then, if there's a problem with supplies, of those substances, also the complementers, those pharmaceutical companies who are finalizing the products and providing them for the whole Europe, it's not what we can solve as the Czech Republic. And why we are in this situation is the pure business, pure economy. Yeah, I mean, the pharmaceutical company will always try to buy it as cheap as possible, the API. Yeah, so if I will produce the API, which will cost 100 Czech crown in the Europe, and the India will produce it for 15 Czech crown, there will be no force for the pharmaceutical company to buy it the more expensive in the Europe. So based on what and how they do the business, they are coming now to very complicated situation. Can we solve it as a Europe? Partially, yes, but it will mean to subsidize the production for years, maybe forever. Because, I mean, the conditions, the cost of the labor work will have to be the same in the Europe as in the India or in the China or in the Latin America. And so we have only the two solutions. And I mean, we have to push, the complementers, those companies, the pharmaceutical companies who are, let's say, preparing the final product, that they have more suppliers. They are not dependent on the demand. We can somehow reflect this situation in our tenders. So, if they will prove that they have a very robust system of supplies of API and the other parts, of they need it, for the final product, then we can reflect it, in our reimbursement. But it will mean to really, push all those who buying. So it's mean the hospital, pharmacies, distributors, they will not tender on the lowest price. Again, it's easy to say, but it's very complicated to do it, yeah. But the Europe really have to do something with that and to really somehow avoid it, those, who have a robust supply chain.
Okay, the last question, if I may, and it relates to the BTC regulation, blood tissue and cells. You already mentioned that. Where is the regulation right now, and do you believe that it will pass through the current European Parliament?
I hope so. Again, I mean, it was one of the pieces of legislation which I was quite afraid that it will be a very difficult discussion. Again, we move it quite far, so we finished all the definitions. We pass it quite far. So I mean, from our side, we are happy that we are moving this legislation in very good condition. So if the Swedish colleagues will provide, the same attention and also the time and resources, the human resources, to manage, the negotiation, we can manage it. We can finish it. But there is still a lot of sensitive topics, especially if you take in consideration that Europe is dependent on the United States. That we are importing more than 40% of the, for example, plasma products from the United States, and there are only four European countries who produce more plasma, for example, than consume, which is the Czech Republic, Hungary, Austria, and Germany. So those four countries will also probably make a push, to the rest of the member states to be more active in this field, and it will be not easy. It's a very sensitive, very ethical topic, and number of states.
It's not about hard numbers and comparing some numbers, but it's about
emotions.
Feeling about what people believe.
Yeah.
Okay, thank you so much for your time, and see you again.
I appreciate it. Thank you very much for the invitation.